Welcome to Seeing Eye to Eye on blackdoctor.org. I'm your host this evening, Shamika Rhymes. Let us know in the chat where you are watching from, and be sure to drop any questions that you may have as we go along tonight. And remember, share this with your network because you never know who might need to see this. So tonight we're diving into an important conversation about workplace eye safety. It's a topic that affects millions of workers across the country because eye injuries can happen in an instant. In fact, I almost had one earlier. But with the right knowledge and prevention strategies, we can protect our vision and our health. So let me introduce you to tonight's guest. We have Dr. Monica Dweck. She's an oculoplastic surgeon, and she's a graduate of Princeton University and Hunter College High School. She received her medical degree from SUNY Downstate Medical Center, College of Medicine, and she completed an internship at Hartford Hospital in Connecticut and her residency in ophthalmology at the New York Ear and Eye Infirmary, where she was the first African-American woman in their training program in their 200-plus year history. That's amazing. And then she went on to do a fellowship in oculoplastic, reconstructive, and orbital surgery at the Cleveland Clinic Foundation. And she was the first woman of color in the country to receive this type of fellowship training. Amazing. Let's welcome Dr. Dweck.
Good evening, everyone. How are you?
Good evening. How are you?
I'm great. I'm very happy to be here to have this chat with everyone.
Thank you for joining us. We also have Dr. Tina Lucas Glass. She is a cornea and external disease eye surgeon, and she received her medical degree from Morehouse School of Medicine in Atlanta, Georgia. She completed her residency in ophthalmology at the Mayo Clinic in Rochester, Minnesota, where she was the first African-American female resident and only the third African-American resident trained in the history of their ophthalmology program. Wow. Like all these firsts. I love this. She completed her ophthalmology training with the Cornea and External Disease Fellowship at Wills Eye Hospital in Philadelphia, Pennsylvania. And she started her solo practice, Alpha Eye Associates LLC, in 1999. So let's welcome Dr. Lucas Glass.
Thank you very much. And
thank you.
Happy to be here.
Thank you. You both have made history. And so thank you both for being here.
Thank you.
So I'm going to start with you, Dr. Lucas Glass. How common are eye injuries in America?
Well, according to the U.S. Bureau on Labor and Statistics, there were over 38,000 eye injuries between 2020 and 2021. So that's over 50 eye injuries per day. And that's only the ones at workplace eye injuries that were reported. Pretty common.
Wow. So this question is for both of you. Dr. Dweck, I'll start with you. What are some of the potential work hazards that can injure the area around the eyes? And, especially with your specialty, can you talk about what eye injuries you've seen?
Okay, so my subspecialty is oculoplastic, reconstructive, and orbital surgery. So I basically fix this part of the face. Okay. A lot of trauma surgery, gunshot wounds, knife injuries, assaults, car accidents, sports injuries, a lot of cancer surgery. I treat surgically thyroid eye disease and all kinds of problems that affect the area around the eye, the socket and the eyelids. And so pretty much anything can happen to that area. It doesn't have to be a dangerous job. You could be in an office and fall and hurt yourself against your doorknob or the side of your desk and break a bone. It could be as simple as that. But then, of course, there are things like high velocity missiles, gunshot wounds. Someone can punch you in the eye no matter what profession or job that you have. These things can happen, and you can easily have a bone around the eye broken.
Okay, wow. Dr. Lucas Glass, how about you? What are some potential work hazards in your specialty that you often see?
Okay, well, my specialty is cornea and external disease. So the cornea is this dome-shaped clear structure that's covering the front of the eye. And normally we don't pay attention to it. Like the crystal on our watch, we look through the cornea and look at the colored part of our eye, which we call the iris. Now, the cornea can be injured in a number of ways. We can have blunt trauma, like Dr. Dweck was saying. We can have burns, and that can be ultraviolet light burns, thermal burns, chemical burns. We can have foreign bodies injure the eye, and they can scratch the cornea, simply cause a scratch from something like an envelope. We can have foreign bodies embedded in the cornea, and unfortunately, we can have foreign bodies cut the cornea open.
Oh, wow. I keep blinking because when you said the envelope, I'm like, that just sounds painful.
Oh, yeah. Envelopes, fingernails.
Yes.
Mhm.
All kinds of
Yeah,
things.
wow. So a bottle of eye drops about took me out earlier. So I had it too close to my eye.
Oh, yeah. Very, very, very common.
Yeah. So let's talk a little bit about the anatomy of the eye so that our viewers understand where eye injuries can occur. You talked a little bit about it, but let's talk about with your specialty area, Dr. Dweck, if you can kind of go into a little more detail about that.
Okay. So I deal with things that happen outside of the eyeball, the bones around the eyes. If they're broken, I can fix them. I also, unfortunately, have to take out many eyes that are diseased or damaged that are beyond repair. And that makes up, unfortunately, a large part of what I do. So anything outside of the eyeball is in my specialty. That includes the eyelids. You can get a dog bite or some type of injury to the eyelids, which can cause a problem. That's the type of thing I would fix. The tear duct is also right in that area between the eyelids and the nose. You have your tear drainage system, and that can also be severely injured. That's also what I can take care of.
Okay, thank you. Dr. Lucas Glass, how about you? Can you talk a little bit about the anatomy of the eye? I know you said you work with the cornea a minute ago, but can you talk a little bit about
Sure.
some of those more about where the eye injuries can occur?
Yes, the eye injuries that I deal with occur anywhere on the eyeball itself. So that could be not only the cornea, which we talked about earlier, but the white of our eye, which we call the conjunctiva, is a membrane in front of the white of the eye, and the sclera is a membrane or the structure beneath. And we see that sclera, or the white of the eye, injured a lot with corneal burns, whether that's thermal burns or chemical burns. We also see foreign bodies cut open, the sclera, which is that part of the white of the eye. The cornea is injured, and when any of those structures are injured, then some of the structures inside the eyeball are injured as well. That can be the lens of the eye. I've had cases where nails have gone and embedded themselves through the cornea into the lens of the eye. We can have injuries to the retina, which is the neural tissue inside the eye. So all of those things can occur from workplace injuries.
Okay. Welcome back, Dr. Dweck. I was like, I hope she comes back. Technology. Dr. Lucas Glass, what occupations are most at risk for eye injuries? Because it seems, even with an envelope, it seems like you could literally be doing anything.
Well, many work environments are at risk, and some you might not expect. But most commonly, we're seeing things like people who work with chemicals, and that can be acids, that can be alkalis, that can be cleaning solutions. Anyone who works with welding, anyone who works with lasers, carpentry and construction workers, anyone who deals with shades or little sharvings or pieces of metal or wood or glass that are formed by hammering or grinding materials. And that can be not only the construction industry, but that can be forestry, that can be mining, that can be fishing and farming. There are many risks in those areas.
Okay. Yeah,
And
it seems like
dealing
a
with
lot.
and dealing with other people, you can get injured.
Yes.
Social workers, people in the healthcare profession.
Mhm.
It can just dealing with anyone who perhaps may have some mental health issues. You can really have any kind of situation that could cause an injury to the eye area.
Wow. I guess you don't think about it. You think about how people will wear goggles going, for whatever profession you need, but you don't think like, I still need to make sure I'm aware of anything near my eyes. I know I worked in a newsroom and someone would launch their headphones every time they got mad and I'd have to duck and I can't imagine if it had hit me in the face.
Exactly.
Yeah.
Exactly.
Yeah. Yeah. Dr. Dweck, well, you mentioned some of the other professions and eye injuries. Are there any others that we may not have even thought about? You know, you mentioned the healthcare workers, social workers dealing with people.
Veterinarians, for example, dog bites, animal bites. Those things can definitely affect the eyelids and the tear ducts. Dog bites tend to shear the lids, tearing the tear duct system, and cause injuries to the lids and to the face often too.
Oh, goodness. Okay.
Policemen.
Policemen, yeah.
Yes.
Firemen. I mean, you name it. Pretty much any job you can be at risk. If you fall in your office and you hit the corner of your desk, that's in your workplace. It's not associated with your profession or your job, but it can still cause serious injury.
Yes, this is true. I've had a teacher with a pencil injury to her eye.
There you go. There you go.
Wow. How did that happen? Now I'm curious. How did that happen? Well, Dr. Lucas Glass, what are some of the common symptoms of injuries to the eyeball?
Sure. Well, blurred vision is one of the most common. Pain, obviously. Sometimes there's floating spots in your eye, we call floaters. There can be flashing lights. Nausea is one of the common symptoms. Patients can also have lots of tearing, lots of burning sensation to their eyes, and in the worst scenario, vision loss.
In addition to that, if you're having trouble moving an eye, or get double vision, or if one eye is protruding more than the other, those types of things also you need to pay attention to.
And bleeding.
And bleed. Oh, yes. Bleed.
Yes.
Yeah.
Yeah, that's a
big
high
one.
on the list.
Dr. Dweck, what are some of the common symptoms like around the eye, like the eyelid, that area that you work on? What are some common symptoms that people should be looking at if they're like, well, you know what, I should probably go get some help for this?
So, for example, if someone is punched in the eye, okay, it can get swollen. But if you cannot open your eye, that's a big problem and may require urgent surgery. And so if that's the case, you definitely get to an emergency room as soon as you can, because there could be bleeding around the eye and behind the eye, which is causing a very tight space. And that can press on the nerve that connects the eye to the brain, and people can lose their vision if it's not addressed as soon as possible. So that's a big one. Bruising around the eye. As I mentioned earlier, if you're having trouble moving an eye, that could be a fracture of the socket where the muscle is getting caught. And so it may not seem like a big deal, but it can be, because those things need to be addressed in a timely fashion.
Okay. What if you, and this is back to you, Dr. Dweck, what should you do if you get hit in the eye with a fist or blunt object? I mean, you mentioned you probably should go to the emergency room, but is there a time at all when it might be okay to just put some ice over your eye and wait it out?
Well, that's a hard one, because I think everyone should go to see someone if they get hit in the eye, because an orbital fracture could be small and not cause any swelling and not cause any bleeding. That's obvious, but it could still be there. And they can develop overnight where you can get swelling and bleeding. It really is hard to say. But yeah, if you get hit in the eye, get it checked out.
Okay. I just thought of another profession, because you guys were talking about it, because little kids if you're, a daycare teacher, throwing things.
Yes.
Big time.
Oh, goodness. Dr. Lucas Glass, what should you do if you or a coworker experiences an eye injury?
Well, that greatly depends on the nature of the injury, obviously. But let's say a splash. If your coworker gets a splash of some chemical or some substance in their eye, get them to the nearest eye wash station at your place of employment to irrigate the eyes. Now, let's say you don't have an eye wash station at work. a bottled water, you have to dilute whatever the substance is and then get them immediately to the emergency room. Now, if it's any other case other than a substance splash, get them immediately to the emergency room. If you see, let's say there's a projectile injury. If you see a nail sticking out of someone's eye,
Oh,
do
yeah.
not try to remove it yourself.
Mhm.
Get them to the emergency room to a medical professional.
Yes.
Yes.
Yes. Do you guys hear that? Go to the emergency room.
Yes.
Do not stop.
But irrigate if it's any splash. Irrigate. The more you irrigate, the better. Yes.
Dr. Dweck, what steps should one take if the eyelid is cut and you're at work?
Okay. So don't put any medicine on it. Don't put any organic material like, in movies or in TV, you'll see people putting a steak on their eye for whatever reason. Please don't do that. Any organic material or frozen peas that have been in contact with food can have bacteria, which can enter the system and cause infections, and that could be a real problem. But you can perhaps cut off the bottom of a paper cup and tape it around the eye area to protect it. Okay. But no pressure on the eye, because that can cause a problem, especially if it's on the eyeball, which Dr. Lucas Glass can address. But yeah, you want to treat it very, very gingerly and get it treated as soon as possible.
Would it be okay to put on your glasses since it's not actually touching, but to just protect your eyes until you can get
as long
to
as
the
it's
ear?
not touching, as long as
Okay.
it's not touching the area? Yes, because you need to see.
Okay.
Okay.
Well, I guess that's another question for Dr. Lucas Glass. What if the actual eye is cut?
Okay. Well, we call it an open globe when the eye is cut open. Our first priority as a doctor is to establish there's no foreign body retained in the eye. So
Mhm.
we'll get a CT scan to make sure that's not the case. Once we've established that, then we would repair the eye with the suture. So they would go into the operating room for a suture repair. Let's say there's a chemical burn. We get lots of chemical burns from alkali or acid solutions. We want to irrigate the eye in the emergency room, and then we have to closely monitor those patients for glaucoma, for cataract developing, for scarring. Scarring is a big one. Sometimes we have to take them to surgery early, and that would be to debride any necrotic or dead tissue. And sometimes we have to take them to surgery later to help restore vision. Now, we get a lot of burns, but there are also thermal burns. And thermal burns, I think in the late 90s and 80s to 90s, which much more common with things like curling irons. And and I don't know if it's a coincidence or not, but thanks to flat irons, I haven't seen them much in my office. Dr. Dweck, what about you?
I have to agree with you on that.
Yes,
Times have changed for sure, and it has
yes.
definitely affected the type of injury that we encounter.
It's true. We still do get the occasional crazy glue injury,
Oh,
where
yes.
where the eyes are glued closed, and we have to debride those. Crazy glue obviously is an adhesive, so it can pull the corneal lining, and they end up with a large scratch once we've removed the glue. And we treat that like any other scratch with medication. Yes.
That brings me to another question, just because, now, of course, we're going from one thing with curling irons, but now you see a lot of people wearing the false eyelashes. So the different glues and things, have you had that where they're getting the glue in their eye?
Sure, sure. I mean, it's not a workplace injury, but yes,
Right.
sure, sure. There's a lot of cosmetic issues that have been affecting the eyes, lashes, and people reacting to the glues. And Dr. Dweck probably sees that a lot with the eyelids.
Oh,
Yes. But also, like you said, contact lens wear, cosmetic contacts that are being dispensed not by a medical professional and getting infections. Yeah, we do see that a lot. Yes.
Wow. Because well, I guess because I come from a TV newsroom, so I was thinking about there was always curling irons, some
Yeah.
eyelashes laying around. So it is the workplace. So.
That's true. That's true.
I think I know the answer to this question, but I'm going to ask you anyway, Dr. Dweck. Should you ever remove an object that is stuck in the areas around your eye?
Absolutely not. By removing it, you could cause a hemorrhage, and let a professional handle it for sure. And it happens much more than you think it should.
Mm-hmm. Well, I think we already kind of talked about any objects in the eye do not go to the emergency room. So this question is for both of you. How does an ophthalmologist fix workplace eye injuries? And this will apply to each of your specialties and the treatments that you would provide. We can start with you, Dr. Dweck.
Okay, so my subspecialty is very surgically oriented. And so most of the injuries that come my way, I have to do surgery on. That could be at the bedside in the emergency room in the middle of the night. You know, if someone's in a car accident or gets beat up. I've had hundreds of those kinds of cases, unfortunately. But surgery is what I usually have to do for those injuries.
Well, who would individuals with eye injuries see at the hospital? Would they ask for, well, I guess if they're hanging onto their eye, they wouldn't be asking for anybody but some help, but who would they see?
The way that works is that they go to the emergency room, they are triaged, and whoever the resident or physician seeing them initially will call an ophthalmology consult. We take on call, okay? So I've been called many a time in the middle of the night to go see a patient and end up often having to do surgery. And if I can't wait until morning to do it because it requires immediate attention, I'll do it sometimes right at the bedside if I have to. But ideally, doing it in an operating room would be best.
Okay.
Yeah, emergency rooms are equipped to know how to deal with things. For example, with me being a cornea specialist, I'm getting chemical injuries a lot. And so the emergency room knows to start immediately copiously irrigating the eyes when there's chemical injuries to try to neutralize the pH so that there's less damage. And they have protocols set in place. They call us in, of course, to see the patients. If it's a simple scratch, from an envelope, like Dr. Dweck mentioned, then of course they don't call us in for that. Our emergency medicine physicians are overqualified to treat things like that. But when there's something surgical, especially, then we're called in.
Okay. Let's see. Well, what can Dr. Lucas Glass, what can employers do to help prevent some of these eye injuries happening in the workplace?
Prevention.
What's their responsibility? Yeah.
Prevention is the key. Now, there's a National Institute on Occupational Safety and Health that's a part of the CDC, and they have established guidelines to help with the safe workplace. We also have the Occupational Safety and Health Administration, which is OSHA, which we're all familiar with that acronym OSHA. And additionally, they make recommendations. These organizations do research. They make recommendations about safety glasses and safety goggles and face shields. So employers can follow their guidelines. And that's prevention is the best, especially with these high risk groups like we discussed, carpentry and construction industries, the ones who work with chemicals, the safety glasses, the safety goggles, the ones who are doing welding, they wear the face shields. So prevention is the best thing that employees can do by following the guidelines and providing these protective eyewear to their employees. Yes.
Dr. Dweck, did you want to weigh in on that as well? I agree totally with Dr. Lucas Glass and her approach to that. There's not much that can be done for the types of injuries I see in terms of preventing unless they're in dangerous professions. However, just be aware, be alert, and be careful.
Yeah. Dr. Lucas Glass, what can the workers do to prevent these eye injuries from happening?
Good question. There, a lot of times um, they can't, but most commonly they can wear the safety goggles, glasses, face shields that are provided to them. I would say over 90% of the injuries I see, the employee will say, I left it my goggles in the car, or I
Mhm.
was sweating and I took off my face shield. And so wear the protective eyewear that's been provided to you. And that's half the battle. I always say, if you're not wearing it, it won't help you. It can't help you over there on the desk. It can't help
Right.
you with your car. So wear what's provided. Yes.
Mhm. I like that. And I think it goes back to what Dr. Dweck just said. Be aware. Be
Yes.
aware what's going on.
Mhm.
Yes.
Well, do either of you have any final comments or advice for those watching? Dr. Dweck, we'll start with you.
So again, be alert and aware of your surroundings. You don't want to take any chances. Don't put medicine on an open wound. Let a professional handle that. Don't use organic material to treat a swollen or red eyelid. Okay. You can use an ice pack or ice in a clean towel to try to reduce the swelling, but it still requires attention. And
Mhm.
basically, just a plug, get an eye exam once or twice a year.
That's a
Yes.
good point. Yes, that's a great reminder.
Mhm.
Dr. Lucas Glass, is there anything that you would like to leave our viewers with tonight?
Okay. Well, just if your employee or your coworker is injured, get them immediately medical attention. Don't try to be an internet doctor and look it up yourself and fix it. Get them to a medical professional right away. And again, to those who are working in high risk environments, wear the safety protection that's provided to you.
It's great advice. It's great advice. Are there any, can you remind us again, Dr. Lucas Glass, of those websites that you mentioned,
The National Institute for Occupational
yes,
Safety and Health
yes,
and OSHA.
yes. So
Yes.
thank you for that. I want to thank you both for joining us here on Seeing Eye to Eye. This has been such a great conversation. Now I'm definitely going to be aware for sure. And
Thank
everybody watching, make sure you share this with your network because, you know, no matter what profession, as we've learned tonight, you can, your eyes are precious. So you want to make sure you're protecting them in the workplace. Um, all right. Well, so for more information on eye health, you can also head over to blackdoctor.org for more information, articles, resources. And I want to thank you again for joining us here. Have a great night.
thank you.
Thank you very much for the opportunity.
Thank you.
Good night.
Good night.